Hello everyone. Today, we are going to talk about panic disorder. And if you still have not watched the introductory video on anxiety, it will be better if you go through it before watching this video. As for a quick recap, anxiety is a feeling of fear about what is to happen. And this is quite normal, if we are in a fearful or stressful situation. And, most of the time, it is the body's natural response when we're in stressful situations. On the other hand, it becomes a disorder when we feel fear and anxiety in perfectly normal situations. So, by definition, anxiety disorders are a cluster of mental illnesses, which cause significant and uncontrollable feelings of anxiety and fear, that can lead to significant damage to the social, occupational, and personal activity of an individual. Anxiety disorders are mainly categorized into three types. They are generalized anxiety disorder, phobic anxiety disorder or simply phobias, and panic disorder. So today we are going to talk about panic disorder. So, panic disorder is characterized by sudden recurrent panic attacks. Panic attacks are sudden periods of intense fear and usually include symptoms of anxiety like palpitations, sweating, shaking, shortness of breath, or a feeling that something terrible is going to happen. So, in anxiety disorder, we mostly see physical symptoms that I have mentioned earlier. Apart from these physical symptoms, they might feel like they're getting a heart attack. And panic disorder is most commonly seen in females compared to males. And also, it is associated with other types of anxiety disorders, major depression, and alcohol misuse. Panic disorder is also known as irritable heart syndrome, Da Costa syndrome, neurocirculatory asthenia, or effort syndrome. The common clinical features of panic disorder are palpitations, choking sensation, chest pain, dizziness, depersonalization, derealization, and there will be feeling like fear of dying, losing control over themselves, and going mad. Depersonalization is a feeling of unreal of themselves. And derealization is the feeling of the world as unreal. The causes of panic disorder can be due to genetic factors, biochemical factors, certain neural mechanisms that we still don't have a clear understanding of. Hyperventilation is also given as a cause of the panic disorder, and especially voluntary overbreathing can induce feelings of panic, stress, and anxiety. Methods of treatment for panic disorder are supportive care, cognitive therapy, and medication. Most of the time these treatment methods are combined together to get the maximum outcomes for the patient. As for medication, the patient can be given short-term benzodiazepines like alprazolam and clonazepam. And antidepressants. Common antidepressants are tricyclic antidepressants like imipramine, clomipramine, lofipramine, and selective serotonin reuptake inhibitors like sertraline, fluoxetine, and serotonin noradrenaline reuptake inhibitors like venlafaxine.
Hope you enjoyed the video and don't forget to like, comment and subscribe.